PCOS, or as we call it PCOS, is short for Polycystic Ovary Syndrome. Basically, it's one of the most common health problem for women in our reproductive age, but it always remains undiagnosed and unmanaged, especially in those who have it. The term polycystic ovary, as the name suggests, means that there's a lot of cysts or tiny bump in the inside of our ovary. Basically, because it's like one of the most common condition disturbing hormone secretion in females, in which our body tend to excrete more male hormones compared to female hormones, and this situation leads to the growth of multiple cysts or tiny bump in the inside of our ovaries. So there's quite a number of causes to PCOS. To name some, there are genetics, our lifestyle, our behavior, or even our environment. All these factors could play a role in causing PCOS, but actually a female may more likely have PCOS if our mother and sister already have it. So, in order to trace down PCOS, there's quite a number of symptoms. To name some, and the most common phrase, it is irregular periods. By saying irregular periods, it means that you have a very heavy period or you have no periods at all. You frequently miss your periods for 3 times or more in a row. Second is hirsutism or hairiness, meaning to say you tend to grow excessive male pattern hair growth on places like the face and the chest, or male pattern baldness. Third, it is obesity or trouble losing weight. 90% of women with PCOS are an overweight or an obese. This does not mean that PCOS only target women with obesity problem, but it's just that the pre-existing condition may worsen the symptoms of PCOS. Right. The next symptom is acne. Acne that appears due to PCOS usually appears in places where male tend to grow their facial hair, such as the lower cheek, the chin, and the jawline. Next is dark skin or folded skin part, such as our neck or underarm. So female with PCOS, they might have dark skin on folded skin part, such as our neck and our underarm. And last but not least, the most feared symptom is infertility. When you have PCOS, when you have tiny bumps, tiny cysts in the inside of your ovaries, it means that your eggs cannot leave your ovaries very regularly. If you have no eggs, then you cannot get pregnant. But it does not mean that if you have PCOS, you cannot get pregnant at all. There's quite a number of alternatives out there, such as contraceptive pill, patches, ring, which can help to balance your hormone levels to help you get pregnant. So if you have any of these symptoms, please don't hesitate to go and see your doctor. However, the symptoms for PCOS may vary for every female. Meaning to say, a female doesn't necessarily have to experience all these symptoms altogether. One might experience hairiness and one might not. Through my reading, I think that there is no specific cure yet for PCOS, but the best tip to help is through lifestyle intervention, in which we need to practice healthy diet and exercise more regularly in order to reduce the symptoms. So, the most common symptom to PCOS is irregular period. If you have missed your periods for 3 times in a row, maybe it's time to call your doctor and get a medical evaluation. So for this purpose, I suggest you to use this app in order to track your period. Also because this app provide quite a number of articles with regard to PCOS. So PCOS, if not treated, may lead to more extreme health damages such as cervical cancer, diabetes, or most likely infertility.